Okay, so today we're going to talk about shortwave diathermy, which is a deep heating modality that, at least up here in Massachusetts in our clinical sites for our students, nobody really uses. I think actually only one of our clinical sites has a diathermy, and every time I go over there to visit the site, they say they use it once or twice a year. So you'll see the abbreviation SWD, that's shortwave diathermy. So we'll talk a little bit about moist heat versus ultrasound versus shortwave diathermy, the different types you'll see in a clinical setting, and the injury response. So what is shortwave diathermy? Well, it uses oscillating high frequency, non-ionizing electromagnetic energy, whoa, similar to radio waves. So this produces deep heat within the tissues, and the FCC, the Federal Communications Commission, actually reserves frequencies that are only for medical use. And you see 13.56, 27.12, and 40.68 megahertz. The 27.12 megahertz is the most used frequency of any of the diathermy units. If you go back and listen to the ultrasound lectures, and you can tell the difference here between ultrasound and shortwave diathermy. So the ultrasound energy is obviously acoustical versus diathermy is electromagnetic. Ultrasound heats collagen-rich tissues versus, and you see the C and I abbreviations under shortwave diathermy, that's capacitive or induction. There's two different types of diathermy. So you can see induction diathermy really heats muscle, blood, and vessels. Do we really want to heat blood vessels? Maybe not. Maybe. I don't know. Heat muscle? Probably. The capacitive heats your adipose tissue, so your fat and your skin. Probably makes no sense, right? To heat your fat and skin. We'd ideally target that muscle. Volume treated, you can treat bigger areas. You can see a larger area with diathermy. Temperature increase for ultrasound, you're not getting as much. With diathermy, with the induction, you can get about an 18-degree change, and the heat retention is a lot different. You can see with ultrasound, it's only about 3 minutes. Diathermy could be about 9 minutes. So thermal effects are very similar to heat, but occur in deeper tissues. These can also be applied on a non-thermal mode, very similar to ultrasound. So you can put a patient on this without the thermal effects. Shortwave diathermy does not reflect from bone and is less likely to create hot spots. Therefore, you're less likely to burn the patient. Also has greater effects on tissue than does ultrasound. Cereal bowl versus ketchup packet. I don't remember. Nope, but I didn't put any notes. I don't remember what that analogy was for. All right. If I think of it, we'll come back. Okay. Use of diathermy has been cyclical. Definitely, I think in the 80s, early 90s, diathermy was very popular. Now, like I said, Chattanooga does sell these, but I don't see them very much. I think George Mason actually has one. In my clinical career, I've probably actually used diathermy a couple times. So leakage of energy from the intended target creates concerns about safety. Older units can interfere with cell phones or computers. Right? And everyone has their cell phone out these days. Everyone's probably looking for Pokemon, right? Two types of diathermy generators. You have the induction and capacitive. So the induction method places the patient in an electromagnetic field, EMF field, produced by the equipment. The line of force is created by a positive and negative pole. In the capacitive field, the diathermy unit uses the patient's tissues in the actual electrical circuit, and this resistance to flow of energy produces the heat. So you can see there is a drum method and a capacitive method. With the drum method, which I think is actually more common, you can actually see that when you place the drum over the patient's tissue, it's heating a little bit of fat, yeah, but it's heating that muscle tissue. It's really not heating bone at all. But if you look at the capacitive plate, it's heating a lot of fat, a little bit of muscle, some bone, right? And this is the other part of the capacitive plate. Like, so you sandwich the patient. The drum method, a little bit of fat, a lot of muscle. So the type and depth of tissues affected and increase in tissue temperature vary between the two induction and capacitive types of diathermy, right? So induction produces the greatest amount of heat within the muscle layer directly beneath the coil, but capacitive affects tissues under each plate and selectively heats adipose tissue and bone. Yeah, this method is very highly dependent upon water content since adipose is made up a lot of water. It's not recommended for patients who have thick adipose layers. So again, that's the nice way of saying that you have some extra fat going on. I have some extra thick adipose layer right now in my belly. I'm still carrying my holiday weight, I like to say. As you get older, it happens. Induction field diathermy. So with the high frequency alternating current, AC, right, flowing through a coil, it creates an electromagnetic field that radiates away from the cable. It's similar to a microwave oven heating food. You could actually technically cook some food underneath a diathermy unit. One of the athletic trainers I used to work with in West Virginia back when he was in college said that one of his professors used to try to make hot dogs during lab using this. I've never tried it. I think that's nuts, but anywho. EMFs arise perpendicular from the cable, causing ions to oscillate. So the ions oscillate, these eddy currents, pretty much the main thing here to know, eddy currents. Eddy currents are created. So when the ions oscillate, they vibrate and they produce heat, right? So density is proportional to tissue's electrical conductivity. Friction caused by the movement of ions produces heat. So essentially, that ion is moving, it's oscillating. That friction caused by the ion oscillating produces heat, and muscle is heated over the adipose tissue. Big thing here, it is delivered via a drum. So if we look back a couple slides, this drum, there's a coil within this drum. Eddy currents are important here. So this is an old school cable that you could actually wrap around a patient back in the day, magnetic field, and then the eddy currents, and that's what produces the heat. All right. Induction field diathermy, the amount of heat produced depends on the strength of the electromagnetic force or field and distance between the tissue and source. Now remember, back in ultrasound, we talked about the inverse square law. This is exactly what the inverse square law is, but now we're just applying it to diathermy. The number of eddy currents is based upon the strength of electromagnetic field, electroconductivity of the tissues. This cable method isn't very common. The drum technique is the best. This is a drum, and there's a coil within here. That's about the diathermy unit. It's freaking huge, right? So if I wanted to heat my biceps, I'm not going to use this. It's too big of an area. But maybe my glutes, my back, my hamstrings, quadriceps, right? And here's the coil. You can see that. Capacitive field diathermy, the tissues are placed between the two electrodes, and it conducts the diathermy's electrical energy. The two insulated plates or electrodes are placed on either side of the body being treated, or side of being treated. It heats the body on both sides. So say we're trying to heat a hamstring, we place it over the quadriceps as well, and we're getting heat on both sides. Think of it as the diathermy plates or the electrodes are two pieces of a bun, right? Top bun, bottom bun, and your body part is, whatever you want inside the bun. Hamburger, BLT, whatever it is, right? Heat is produced by the dipole effect. So a pair of equal and opposite charges separated by a distance. Current flows along the path of least resistance, and a heat is created in the superficial tissues. Is adipose a good conductor of electrical energy? Is it? I don't know. We talked about this. What do you guys think? So in your head right now, right, answer that. What do you think? To ensure heating, the electrodes must be placed on equal distance from the skin and opposite sides of the body part. And we keep it about 3 centimeters from the skin. So bam. These are equal distance from the skin, body part. So we're heating essentially the fibula right there. But if one electrode or plate is too close to the skin versus the other plate, it's going to have more heat at the electrode that is closer to the skin, as you can see with this photo. So again, diathermy can be continuous or pulsed. Continuous increases the subcutaneous tissue level. Typically, continuous is limited to chronic conditions. Output may also be pulsed, allowing for acute conditions to be treated. This prevents increase in tissue temps from increasing too high or too fast. Unlike ultrasound, pulse current can be used to produce thermal effects. So do not confuse non-thermal and pulsed for diathermy. Ultrasound is different. This is where students get confused, and I don't want to screw you up here. Unlike ultrasound, pulse current can still be used to produce thermal effects with diathermy. Do not confuse non-thermal and pulsed diathermy. It is different than ultrasound. Biophysical effects of diathermy. Fancy words, right? High frequency electromagnetic energy, greater than 10 megahertz, is absorbed by patient's tissues. So if we know the absorption rate describes the rate of energy absorption per area of tissue, per unit of area tissue. What does that mean? Well, if we know the electromagnetic energy is absorbed by patient's tissues high frequency, we can understand the rate of absorption per area of tissue. So when we set up the unit, we can do some play with the parameters a little bit to, target the tissue the best. The non-thermal effects, using a low number of pulses, a short pulse duration, and low average output intensity, output usually less than 38 watts. This changes the way the ions bind to the cell membrane and produce the non-thermal effect due to the electromagnetic energy that is absorbed. So some thermal effects, right, increases intramuscular temperature. The induction method heats muscle and blood, but not adipose. That's the most common form or method that we use for diathermy. The capacitive method heats tissues that are not good electrical conductors, skin, fat. Effects on inflammation, so non-thermal. Alters the rate of diffusion across cell membrane. Why might this be important? Does that maybe have something to do with swelling? Pain? Probably not pain. So in your head right now, what do you guys think are some reasons that the non-thermal diathermy has effects on inflammation? Maybe I'll put that as a discussion board or a quiz question. It's in your book. Thermal effects increases the rate of cell metabolism. So an increase about 18 degrees Fahrenheit in the muscle will double the rate of cell metabolism. Why is that important? Big thing here, it increases the delivery and concentration of white blood cells. Remember, white blood cells remove cell debris and metabolic toxins. White blood cells are our friends. We like white blood cells. So maybe you want the thermal effect over the non-thermal. Effects of nerve and pain control, the same as heat. So we did that a couple weeks ago now, right? If we know the effects of nerve and pain control that moist heat or heat does, that even though it's superficial, this is deep heating, remember, it's the same. Blood and fluid dynamics, vasodilation, that increases blood flow. What else happens due to this? So when vasodilation occurs, fluid dynamics, if we're having a heating effect, the blood probably becomes more viscous, right? Wound healing. I've never used this for wound healing. Pulse shortwave diathermy increases white blood cell count, resulting in rapid healing. Makes sense. White blood cells help with healing, so therefore should help with wound healing. Does this make sense for superficial open wounds? Maybe. Tissue elongation, or elasticity, elongation is obtained by altering the viscoelastic properties of deep, collagen-rich, fibrous tissues. If we want to stretch a hamstring, elongate a hamstring, we can stretch it till the cows come home, whatever that means, right? We would stretch it like every day. It probably won't change much. We have to deform that plastic tissue and elongate that tissue. How do we deform it? Heating it, stretching it, getting into that plastic deformation within 9 minutes. Remember, with diathermy, you have about a 9-minute window to really heat the tissue and see the effects of that heat. Yeah. If you look in the literature, there's some literature on diathermy, but not very much, I will say. So I said there's limited evidence on the efficacy of shortwave diathermy. There are so many contraindications. So next chapter, we will go over how the clinical application of shortwave diathermy is it cost effective. These things, these units, 8 to 10 grand. I mean, they're not cheap. It's very similar to a moist hot pack and ultrasound, but remember, moist hot pack is superficial heating. Ultrasound theoretically could be both. It could be superficial or a deep heating modality. That's all. This lecture is pretty short.